Saturday, November 4, 2017. Can caffeine help people with chronic kidney disease live longer? That's the suggestion of a new study that found that among more than 2,300 Americans with chronic kidney disease, those who drank the most caffeinated drinks reduced the risk of premature death by 24%. Our study showed a dose-dependent protective effect of caffeine consumption on all-cause mortality among patients with chronic kidney disease, said lead researcher Dr. Miguel Bigot Vieira, from the Centro Hospitalar Lisboa Norte in Lisbon, Portugal. However, our observational study cannot prove that caffeine reduces the risk of death, but only suggests the possibility of such a protective effect, he said. Moreover, the reasons that caffeine might be protective aren't clear, and how much caffeine is too little and how much might be too much also isn't known, Bigot Vieira added. The findings also need to be replicated in a trial that compares caffeine consumption with no caffeine consumption before patients are counseled to drink more coffee or other caffeinated drinks, he noted. In the study, the research team found that those who consumed the least amount of caffeine saw no reduction in death risk, those who had the second higher amount reduced the risk by 12%, those who had the third higher amount reduced the risk by 22%, and those who consumed the most caffeine reduced their risk by 24%. The association between caffeine and a reduced risk of premature death was independent of factors such as age, gender, race, family income, education, creatinine levels, a marker of kidney troubles, high blood pressure, smoking, high cholesterol, body weight, previous cardiovascular problems and diet, Bigot Vieira said. The findings were to be presented Friday at the American Society of Nephrology annual meeting in New Orleans. Research presented at meetings is considered preliminary until published in a peer-reviewed journal. Dr. Leslie Spry, from the Lincoln Nephrology Hypertension Dialysis Center in Nebraska, said, "I hope this is the case, as I sit here and drink my morning coffee." Spry is also a spokesman for the National Kidney Foundation. "As you know, there are studies of coffee being harmful, beneficial and having no effect on health," he said. This is yet another observational study, Spry noted, where only an association was found, not cause and effect. Given the relatively small size of the study, and the small reduction in death risk, Spry said he is not willing to tell kidney patients that the more caffeine they drink, the longer they'll live. "I would rather say that, compared to little or no caffeine intake, those people with the highest intake of caffeine as estimated by Dietary Recall, may have a lower mortality, but the reason for this low mortality is not proven by this association research," he said. More information: visit the National Kidney Foundation for more on kidney disease. Copyright 2017 Health Day. All rights reserved.